Jacqueline, the first thing to know here is that the Biden administration is approaching this differently than the Trump administration, doing some things on a national level instead of going state by state. And for example, saying that we're going to get some guidance on reopening schools from a national level. But there are still questions about how things like vaccination centers will work and whether the administration can meet that goal of 100 million vaccines in 100 days.
Good afternoon.
President Biden on his first full day in office, signing orders that could affect when and where you get a coronavirus vaccine.
We'll move heaven and earth to get more people vaccinated for free and create more places for them to get vaccinated, to mobilize more medical teams to get shots in people's arms, and to increase vaccine supply and get it out the door as fast as possible.
President Biden's COVID-19 plan aiming to increase access to testing and PPE and vaccines, which have rolled out with fewer doses and varying, sometimes confusing procedures for who gets them, with the virus still a threat to Americans across the country.
Now everybody's just scared to death, and I don't think we need to live in fear.
Obadiah Anderson says she's hopeful she'll be able to get a vaccine in the new administration.
So I'm hoping that I'm one of the blessed ones.
The Biden administration is aiming to vaccinate 100 million people in 100 days, part of the national strategy the new president launched today. The new Biden plan calls for federal guidance not yet out on reopening schools, requiring masks in airports and on certain transit. And on vaccines, the plan is to make them available in pharmacies starting in early February, and for FEMA to create community vaccination centers, 100 of them in the next month. I reached out to FEMA in the Philadelphia region about where they'll be, and a spokesperson told me, quote, "These decisions will be made in collaboration between local, state, and federal officials. The process is federally supported, state managed, and locally executed."
But I think getting the clinics in the right place, staffed by the right people, and taking on the issues of trust and hesitancy will be critical components to the success of those community vaccination clinics.
Dr. Charles Cairns is Dean of the College of Medicine at Drexel University. He laid out some of the challenges ahead.
We do need to ramp up the distribution of the vaccines we already have. We have to increase the amount of vaccine available for distribution, and we really need to take on issues of vaccine so that the people who are offered vaccines will take them.
President Biden today setting expectations for how long it will take to overtake the pandemic.
We didn't get into this mess overnight. It's going to take months for us to turn things around. But let me be equally clear. We will get through this.
You saw President Biden signing executive orders today, but not everything can be solved that way. For some things, he is going to need money from Congress. For example, he wants to hire more public health workers, but it is not clear how much money he'll be able to get. I'm Mayk, NBC10 News.